Good evening. A very good evening to all of you. So, let us begin with the surgery challenge. Here, we are going to do the most important topics in surgery in the form of multiple choice question. So, this challenge begins right now. Please comment in the comment box. Please comment in the comment box. Are you ready? Are you ready? Okay, let's begin. Most common cause of small intestinal obstruction is most common cause of small intestinal obstruction is A. Intussusception, B. Idiopathic adhesions tumors, C. Post tumors, D. Postoperative adhesions. Small intestinal obstruction most common cause is A. Intussusception, B. Idiopathic adhesions, C. Tumors, D. Postoperative adhesions. So the correct answer here is post-operative adhesions. Why post-operative adhesions? Let us discuss why it is post-operative adhesions. The most common cause of small bowel obstruction is post-surgical adhesions or post-operative adhesions. The most common cause of intestinal obstruction is intestinal adhesion, that is, bands of fibrous tissue in the abdominal cavity that can form either by abdominal or pelvic surgery. Now, coming to intussusception, in children, the most common cause of intestinal obstruction is telescoping of intestine, which is seen in intussusception. So, in children, it is intussusception, whereas in adults, it is post-operative adhesions. Let us move on to the next question. First step in trauma is First step in trauma is A. Blood transfusion, B. IV fluids, C. Reconstruction, D. Maintenance of airway. Anyway, the first step is always maintenance of airway. So it is maintenance of airways. The advantage of bladder drainage over enteric drainage after pancreatic transplantation is better monitoring of A. HbA1c levels, B. Amylase levels, C. Glucose levels, D. Electrolyte levels. The advantage of bladder drainage over enteric drainage after pancreatic transplantation is better monitoring of A. HbA1c levels, B. Amylase levels, C. Glucose levels, D. Electrolyte levels. So, urinary drainage of pancreas has the advantage that you can monitor the urinary amylase level. Urinary amylase level can be used to monitor any graft rejection. So, the correct answer here is amylase levels. Now, coming to Cox specular tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst, D. Cylindrome. What do you think is the correct answer here? Now, this Cox specular tumor is an ulcerated sebaceous cyst. Cox specular tumor is a sebaceous cyst linked growth that can resemble a squamous cell carcinoma, but it is not squamous cell carcinoma. The proliferating cyst, that is Cox specular tumor, is usually solitary, but it often arises from simple tricholemmal cyst in the hair follicle epithelium. So this Cox specular tumor arises from simple tricholemmal cyst in the hair follicle epithelium. So the correct answer here is ulcerated sebaceous cyst. Sacrococcygeal teratoma is embryological remnant of. Well, this question is very important. Sacrococcygeal teratoma is embryological remnant of A. Neural tube, B. Allantois, C. Notochord, D. Primitive streak. Sacrococcygeal teratoma is embryological remnant of. This sacrococcygeal tumor teratoma is more common in females. Teratomas occur most frequently in the neonatal period, and sacrococcygeal region is the most common site. It is more common in females. It is thought to be a derivative of primitive streak. Primitive streak. So the correct answer here is primitive streak. Most often, an obvious external presacral mass. Most of the tumor is usually external with minimal intrapelvic presacral component. Minimal intrapelvic presacral component. These lesions should be carefully followed with serial ultrasonography until delivery because blood supply to the tumor may grow to the point of stealing a significant proportion of placental blood flow to the fetus. The development of hydrops or placentomegaly is associated with a poor prognosis. Most neonatal sacrococcygeal teratoma are benign. Incidence of malignancy is related to age at the time of diagnosis and is most frequently represented as yolk sac tumor or embryonal carcinoma. Complete surgical excision through chevron-shaped buttock incision is the treatment. Resection of coccyx is critical because failure to remove coccyx results in significant higher local recurrence effects. So the correct option here is primitive streak. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. 5-year survival rate after treatment is 60%. Stomach is the most common extranodal site of lymphoma. It is of two types, primary and secondary. Primary gastric lymphoma is the lymphoma of stomach which exhibits no evidence of liver, spleen, and mediastinal lymph node or bone marrow involvement at the time of diagnosis. Regional lymph node involvement may be present. Primary gastric lymphoma is mainly non-Hodgkin's lymphoma of B cell origin. Most of the primary lymphomas arise in MALT, that is, mucosa associated lymphoid tissue. MALT is usually associated with chronic H. pylori infection. So, low grade MALT lymphomas are thought to arise because of chronic H. pylori infection. These low grade lymphoma may later on degenerate to high grade lymphoma. Immunodeficiency and H. pylori infection are the risk factors for B cell lymphoma. Most common site of involvement, like that of adenocarcinoma, is gastric antrum. Secondary gastric lymphoma, stomach is the most common extranodal site of systemic lymphoma. Almost all of them are non-Hodgkin's type. Treatment: the role of gastric resection is controversial. So the correct answer here is total gastrectomy with adjuvant chemotherapy is treatment of choice is false. Which one of the following preservatives is used while packing catgut seizure? A. Isopropyl alcohol. B. Colloidal iodine. C. Glutaraldehyde. D. Hydrogen peroxide. So, which is used as a preservative in catgut seizure? 10% isopropyl alcohol is a routine packing fluid used for packing catgut suture. Catgut suture is available in glass tubes containing isopropyl alcohol and a small quantity of water. Catgut is prepared from the intestine of sheep. Catgut is prepared from intestine of sheep. So the correct answer here is isopropyl alcohol. Please click the link in the description box to join the 2-day ultimate NEET PG Breakthrough Blueprint Masterclass. Primary hyperparathyroidism, pheochromocytoma may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid. B. Papillary carcinoma of thyroid. C. Anaplastic carcinoma of thyroid. D. Follicular carcinoma of thyroid. So the correct answer here is medullary carcinoma of thyroid. So what happens? It is characterized by medullary carcinoma of thyroid, pheochromocytoma, hyperparathyroidism. Approximately 70 to 95% of individuals with MEN2A develop medullary thyroid cancer. 50% develop pheochromocytoma and 15 to 30% develop hyperparathyroidism. So the correct answer here is medullary carcinoma of thyroid. Please click the link in the description box to join the 2-day NEET PG Breakthrough Blueprint Masterclass. Meconium ileus is associated with A. Cystic fibrosis, B. Infant of diabetic mother, C. Hypothyroidism, D. None of the above. So this meconium ileus is associated with cystic fibrosis. Infants with cystic fibrosis have characteristic pancreatic enzyme deficiency and abnormal chloride secretion in the intestine that result in production of viscous, waterproof meconium. Meconium ileus occurs when the thick, highly viscous meconium becomes impacted in the ileum and leads to high-grade intestinal obstruction. You can directly WhatsApp me in this number 9483652020 for any doubts regarding the PG entrance or INACT. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve. B. 10th thoracic nerve. C. 11th thoracic nerve. D. Iliohypogastric nerve. So correct answer here is iliohypogastric nerve. Dysphagia lassoria is due to A. Esophageal diverticulum, B. Aneurysm of aorta, C. Esophageal web, D. Compression by aberrant blood vessel. So the correct answer here is compression by aberrant blood vessel. Surgery for undescended testis is recommended at what age? It is at 6 months. Dacron vascular graft is textile biologic, textile synthetic, D. Non-textile biologic, D. Non-textile synthetic. Correct answer here is textile synthetic. What is the most common position of appendix? A. Pelvic, B. Paracolic, C. Retrocecal, D. Retroperitoneal. The most common position of appendix is retrocecal. Double bubble sign is seen in A. Duodenal atresia, B. Duodenal stenosis, C. Volvulus, D. On. Double bubble sign is seen in what? Can you answer this question, please? Anybody? Please type in the chat box. What is the correct answer here? Double bubble sign is seen in duodenal atresia, duodenal stenosis, volvulus. Double bubble sign is seen in duodenal atresia, duodenal web stenosis, Lard's band, annular pancreas, malrotation of gut, pre-duodenal vein. Distal gas is more often seen with midgut volvulus. Duodenal stenosis can also cause double bubble sign. However, if the stenosis is present, at least a small amount of gas may be present distal to obstruction. So, double bubble sign is seen in duodenal web, duodenal atresia, duodenal stenosis, volvulus. So, all is the correct answer. Curling ulcer is seen in A. Burns patient, B. Patient with head injury, C. Jollinger-Ellison syndrome, D. Analgesic drug abuse. Jollinger-Ellison syndrome, analgesic drug abuse. So, patient with head injury, you will see Cushing's ulcer. Curling ulcer is seen in Burns patient. Curling ulcer are stress ulcer associated with burns and most commonly found in the first part of duodenum. Curling ulcer is acute gastric erosion resulting as a complication from severe burns when reduced plasma volume leads to ischemia and cell necrosis of the gastric mucosa. So the correct answer here is burns patient. All are true about amoebic liver abscess. A. More common in females. B. More common in left lobe of liver. C. Metronidazole is the mainstay of treatment. D. A and B. Correct answer here is A and B. Now we will see about amoebic ulcer. Very important. Amoebic liver abscess. Male preponderance is more of greater than 10:1 has been reported in all the cases. The right lobe of liver is more commonly affected than the left lobe. That's why the option A and B are not correct because it is more common in females, it is more common in right lobe of liver. So the correct answer here is D, A and B. So let us indications of liver transplant are all biliary atresia, sclerosing cholangitis, hepatitis A, D cirrhosis. Liver transplantation is indicated for all those children and adults who, in the absence of contraindications, suffer severe irreversible liver disease for which alternative medical or surgical treatment have been exhausted or are unavailable. Most common indication in children is biliary atresia. Biliary atresia. Chronic hepatitis C and alcoholic liver disease are the most common indications for liver transplantation of all adult candidates who undergo the procedure. So in children, it is biliary atresia, whereas in adults, it is chronic hepatitis C and alcoholic liver disease. So the correct answer here is hepatitis A. In hepatitis A, you don't do liver transplantation. Kehr's sign is seen in splenic rupture. A. Pain over left shoulder. B. Pain over right scapula. C. Periumbilical pain. D. Pain over renal. It is pain over left shoulder. Pain over left shoulder, that is splenic rupture. Pain may be referred to tip of left shoulder. It is known as Kehr's sign. It occurs due to irritation of undersurface of diaphragm, blood, and pain is referred to shoulder through affected fibers of phrenic nerve. Kehr's sign can be elicited by bimanual compression of left upper quadrant after the patient has been in Trendelenburg position. So the correct answer here is pain over left shoulder. Breast conservation surgery is not indicated in A. Large pendular breast, B. SLE, C. Diffuse microcalcification, D. All. Complications of breast conservation surgery include seroma, hematoma, fat necrosis, infection with development of cellulitis. Correct answer here is D. All. Mondor's disease is it is thrombophlebitis of superficial veins of breast. Lateral aberrant thyroid refers to A. Congenital thyroid abnormality, B. Metastatic focus in lymph node, C. Struma ovary, D. Lingual thyroid. Correct answer is metastatic focus in lymph node. Most common site of CA esophagus is this is another important question. Middle one third. Corkscrew esophagus is seen in which of the following condition? It is diffuse esophageal spasm. The most common type of tracheoesophageal fistula is esophageal atresia with distal tracheoesophageal fistula. The best investigative modality for gallbladder stone is ultrasound. Strawberry gallbladder is seen in cholesterosis. Viapoma is associated with which syndrome? It is associated with Werner's Morris's syndrome. All are resected in Whipple's operation. It is neck of pancreas is not resected. The tendency of colonic carcinoma is best assessed by depth of penetration of bowel wall. Commonest cause of intussusception is hypertrophy of submucous pair patches.